I mean, I think that those people who keep abreast of the medical literature, there's always a temptation in the back of your head to say, well, maybe I should try this myself. And I will tell you that my friend was a very senior guy at Merck, and he said their old CEO, this is many CEOs ago, so I won't say who, and their old head of research, every now and then they'd go to the labs and do one of these things. They would take their finger and go, lick their finger, put it in a random Merck research chemical and taste it. No joke. So at the end of the day, you know, people have been experimenting with medicine a long time, but I think the point is, you know, I wouldn't, Rick's really killed it at Lilly. You know, I feel like the average Joe shouldn't do it. If you're a high-end scientist and you have a bit of a wild side, or you want to try chemicals for no reason, the one thing I'll tell you is you can't take peptides orally, right? Most peptides degrade completely under low pH. It's a very weak bonds, so you get protonation. You get complete degradation of peptides. So I think you automatically are not, looking at these drugs the right way. But contraceptives are not proteins. No, they're actually sterols. Estrogen is a sterol. It's formed from cholesterol. Estrogen and testosterone make up the androgen class. Would not try KCN. Potassium cyanide. My favorite. I love it. Yeah, don't do it with potassium cyanide. That's for sure. Okay, market worsening here, down 2.4%. Portfolio is up 30 basis points in response. It's hard to make performance-enhancing drugs because, our systems are pretty fine-tuned. All right, so what's this? 𝗬𝗢𝗄𝗃 is up 700%. No, I don't like to short really low market cap stocks. It does look like a scam. I'm sure shorting it will make you some money if you can find a borrow. Sometimes those things are hard to find a borrow for. It's kind of like the whole Webull thing, and we see tons of these, right? We see tons of these all the time, and they're just kind of, it's the closest thing as you'll get to a game in the stock market. You know how there's different systems, like chat systems, and sometimes there's a game embedded in it. Sometimes you could play Scrabble or Words with Friends on Facebook, but Facebook's not a game system really. It's mostly a messaging system, but every now and then there's a game embedded. There's kind of a mini game in the stock market with stocks like this. And it's up to you if you want to play the mini game or not. I mean, anything below 100 million is a pretty small market cap that could be manipulated, but the smaller it gets, the more logarithmic, you can kind of expect the chicanery to be. Dusty is actually very, very good at these little micro caps, nano caps even. If you have a really small capital base, you can kind of play these things a little bit, but I'd be very, very careful how you play them. And I generally, being long them is very risky and dangerous. I think you're basically lighting your money on fire, but, every now and then, there's some kind of, you can kind of get a greater fool phenomenon going. But you got to be real careful. Shorting them is risky too. No doubt about it. Because you're going to have the reverse problem. You're going to be right 90% of the time. But the one time that stock, even for the wrong reasons, goes up and stays up and persists for, months or even years before it goes down, you're sitting there cooked. So you want to see what we're holding? Okay, no problem. So we're up 30 basis points for the month. It's not much, but I'll take it in a month where the S&P has to be down 10% this month, something like that. We got, in order, biggest shorts, Rigetti, IonQ, Lilly, which I'm gonna cover. It was not intentional, or not. I wouldn't say not intentional, but not a long-term position. INMB, my number 3 short. QUBT, which is Quantum Computing Inc., their CEO resigned after a board investigation. QBTS, D-Wave, soon to be F-Wave. Anavex, Capricorn, full of cap. Unicure, which was supposed to be a really short-term play, but it's not going the way I want. RTX, Strategy, RXRX, which is Recursion, so-called AI drug company. Huma, which is Humacyte, That's the short book. Okay, long book. Thera Technologies, which is a takeover situation. I think that company will get taken over. NVIDIA is number 2. Novo Nordisk, number 3, has been just absolutely pummeled. But we're in at a good price. Sarepta, same story. Hims, same story. Meta, bit of a there's something to weigh the long portfolio against the shorts. Union Pacific, the legendary railroad company. IVVD, kind of one of the few, 2 or 3 very small cap biotech plays I have. Google, again, kind of just to weigh out the portfolio. PayPal, which is one of the few longs we're actually up on. Resolute, RZLT, another, along with IVVD, kind of a micro cap, small cap long ploy. American Express, Tarsus, and Farming. That's the long book against the short book. I'm really confident in this portfolio, making a lot of money. But it's going to do so slowly and carefully, which is the point. You know, you guys asked me, how would you take a brand new account and grow it? And you asked me for kind of picking a relatable amount of money. So I gave you a poll and you said do $30,000. I said, okay. Gilead, yeah, Zonegran, that is probably what I'm going to do. I want to spend a little more time researching lenacapavir because I think, one, I mean, the problem is it's got the word cap in the name, okay? So we're talking about Capricor as a short. Well, now Gilead's new biggest drug is going to be called lenacapavir. The problem is that might be cap. If it's cap, we got a problem. Now, all jokes aside, I do think I want to check to see if, will lenacapavir really take over the entire, the entire space? It's not clear. It's early days in HIV for injectables, and I don't know that this patient population loves injectables. Obviously some of the injectables have done okay from like GSK and so forth, but I don't know. It's not to me that compelling. But it depends on pricing too. We don't know what the pricing is. Yeah, I get that. There are some HIV patients that like injecting a little too much. But it is also a twice-a-year injection, and I think it's a sub-Q, but I could be wrong. It may not be a sub-Q. It's depending on how painful it is. I don't know that it's... And then Gilead has to replace a lot of revenue that's going to go away, right? I mean, 𝗥𝗏𝗘𝗢 is also one of the biggest drugs. Right. Seth is asking some good questions here. Why switch, right? Why switch? And I think there's some convenient switching. Like, for example, having the drug on board and not having to worry about remembering your medicine. You really don't want to skip a dose of HIV medicine. So you want to have a really careful compliance. And it's a lot easier if you inject, but I don't know. The HIV community tends to go very quickly to the newest and latest. Gilead has proven that over and over and over again. So I think they'll do fine. They really seem to own the HIV space, including the doctors in the space. So I think that you'll do fine, right? I think they'll do fine. But you also have to keep in mind that 𝗥𝗏𝗘𝗢 is not going to live forever either. And at some point, everyone's making this point, but it remains, I have to make it over again. Well, I guess I'm not sure everyone's making this point. The idea I have here is that drugs have to incrementally get better. And there's certain drug classes, in order to replace the old drugs at least. Now, there's certain drug classes where you can't do a whole lot better. In the case of Gilead, the only better thing you could do at this point would be a complete cure, complete eradication of the virus from the patient, which is maybe technically impossible. So lenacapavir is kind of the second best thing to that, which is kind of a very good prophylaxis. The only thing I could see that's better is sort of like a permanent prophylaxis, maybe gene therapy, that is consistently making onboard neutralizing antibodies, or even an onboard nuke, could be an interesting idea. I mean, you can't code small molecules, right, and proteins, but, you can code siRNAs and things like that. So who knows? So in any event, there are a lot of diseases you have to think about this way. How do you make a better, blood pressure drug? You really can't. How do you make a better cholesterol drug? You really can't. So once these diseases have sort of gotten, have gotten where they've gotten, how are you going to improve? Now, insulin's a different one. Insulin, is a different drug depending on whether you're type 1 or type 2. And they've certainly made better insulins. Like insulin Lispro is an analog of insulin. So it's not always, you get better glucose response, etc. So better dosing. So there's basal insulin, and there's mealtime insulin. Yeah, we don't really need to do protein folding anymore. It was never really a big deal anyway. I think the average person misunderstands protein folding as this really important thing, or like, in pharma, we just pretty easily do a X-ray crystallography. Now, there are some proteins that are hard to crystallize, but there's no catalysts, right? The DARPA awards have been given out, the whole $1 million. Wow. Reminds you when your grandma gives you a nickel, because it was a lot of money back in her day. And then, what are you going to get? Earnings? INQ can give you some fake earnings, but you're not going to, it's not real money. They're getting all kinds of weird, strange earnings. So we assume 𝗥𝗘𝗃 goes to 0. Not much difference between goog and googl. Let's say you wanted to tell the difference. Goog, equity, HMS. Okay, there's the Google chart. Add ticker, googl. You can see they're almost completely superimposable, but they're very slight differences. And I think it'd be good if we could maybe get a finer point here or graph the spread. And I think we can do that soon. You should be able to graph the subtraction of these two. So coming soon. We're in it for the long haul. We want all you guys who are just starting out your finance careers. Might be around finance next 30, 40 years. I'm talking about my business. We're interested in the long run. We're building a financial platform that will exist in 20, 30 years, I hope. Doesn't mean we're not hustling hard. It's hard work to become an overnight success. I was doing some fun programming, 300-line program that just tries to parse 10 Qs, turn them into CSVs. Being a bear is this fun? Yeah, being a bear can be fun. It does the chunking correctly, but it doesn't. It's just a model. These models aren't trained on spitting out CSV files, Revenue growth slowing? Hit them with the price increase. Shareholders mad? Hit them with the price increase. Board upset? Hit them with another price increase. Yeah, no, Ivan. I think it's pretty easy when you have the table, so I might do some other steps. But like if you just try to throw a whole 10Q into any model and say, pull me out an income statement or something, it sucks. Again, the devil's in the details. This is really what I'm good at. So if it's missing shares outstanding, I don't like that. If it's giving me dividends, I didn't ask for that. That's not normally part of an income statement. So there's little details like that. The columns are in the wrong order. All kinds of tiny little things like that are really important to me. And they're important to customers too. Because most of the customers are like me. We're annoying. We want it a specific way, No, I think students are locked in on their student prices. But we may deprecate some student features. There's some features that cost us a lot of money. Now, we also value students because they're future users, right? Eventually, the student turns pro. So we're willing to lose money on students, but I don't want to lose too much money. Price decreases? You're kidding, right? Now, eventually, there could be a price decrease when we go to usage-based pricing. I've done price decreases and price increases. Both are important tools in business, but when you're dealing with politicians on the other side, price decreases are great when you're one, you can afford it. That's what sometimes the FTC calls a predatory price increase. Predatory price decrease. If the price increases, it's gouging. If the price decreases, it's predatory. If the price is the same, well, that's collusion. Yeah, so I guess Gilead, the transformation of their HIV business is going to look a little bit different than I anticipated. For 20 years, Gilead's always been kind of balancing their life cycle management business or their life cycle management plan for HIV. I guess they're going to go to like once monthly, maybe. This is kind of what it looks like. A new kind of NRTTI, nucleoside reverse transcriptase translocation inhibitor. I wonder if that's just a meme. I guess one way or another, they're going to not let Biktarvy oral be, or at least once a day oral be the be all end all. They're going to try to get to once a week or once a month. I still don't really know how they're going to get the IP there. I guess they just need one of the drugs in the cocktail to have IP. And in that case, you have lenacapavir that still has the IP. Interesting. So if you go on Godel and type Gilead equity EM, see Gilead's at 13 times PE. Look at the sales. See sales are not growing too much, so that's kind of the rub. But still 13 times is better. There's a lot of other stocks, large caps that are not growing either, and they're still 30 times. Haven't looked at Sanofi too closely. I mean, Dupixent biosimilar would be the risk there, which Dupixent's getting older, so I would imagine at some point soon here you could be looking at a Dupixent biosimilar. I don't know if it's going to go down further or not. If I knew that, I'd be able to tell the future. But I do like it. The Novus is up 20%. Austin, they're different. One is better or the other. I mean, you don't have to invest. I mean, nobody's puts a gun to your head and says, buy some stocks. You know, and anybody who's telling you you have to invest is wrong. Most people cannot make good returns. So better to be careful. I'll be back in 1 second. One of the best investors on Wall Street is Paul Singer, Elliott. And Elliott's made about 10% a year or so since, I mean, it's been pretty good since it started. But that's, I mean, for a lot of people, 10%, they say, what is that? Well, compounding kind of works slowly. And then after you compound a lot, it works pretty quickly. But the first 5-10 years up that curve are a little slow. So, you know, you don't need to put your money somewhere. If somebody says you got to put in the S&P, that's the best thing to do. Well, cash can work too. I mean, having cash is nice. You can save your way to being rich if you earn a lot. No, I'd be bullish on Gilead. Their life cycle plan isn't too transparent. It's like very, very unclear to me, but I think they'll get there. I also don't know how they're going to grow much, but I like it. I was just reading about the Meta antitrust trial. I'm so disgusted. Useless FTC. Bristol's actually dropped a bunch from when I last looked at it. I don't think it's going to change too much any individual company. How do you find a smart girlfriend? Well, you got to be pretty smart yourself. Yes. A lot of those smart girls that don't want to be around some dummy. Unless you look like unless you're a bodybuilder or something. Yeah, I just covered Lily. Girls will always be attracted to guys with big muscles. Don't be silly. Whoever told you that's not true is women want big guys with big muscles. Don't be stupid. Ask any girl, you like tall guys or short guys? I'm not saying you can't find a girlfriend, but women want strong men, period, the end. It's just natural. I'm 5'9". All right, Sprycel finally went generic. I'm not saying you're going to get every girl like that. Okay, Camzyos doing well. 10 million, kick it off. Could you imagine going through limb lengthening surgery just to be a little taller? Christ. I hate this drug here, boy. I don't know why it's doing so well. Reblizol's one of my favorites, though. That drug is a beast. Yeah, Breyanzi. Must have been a label expansion or something. So Sotyktu's the big disappointment. Real slow launch for Sotyktu. Probably be $1 billion drug, but not a whole lot more. I mean, they've had some pretty consistent revenue growth, but most of the Bristol portfolio is pretty mature. It is all biologics, which is impressive. There are some double-blind placebo-controlled studies for vaccines. The problem with vaccines is that you don't get the patient, the clinical trial population, the patients in those trials are not the same as the epidemiological trial, which is basically going to be subject to lots of different things. And that's not a trial in the clinical sense or the regulatory sense. That's the real world. It's the real world. You actually have to give that drug to millions of people, that vaccine. You don't know if it's going to mimic the vaccine in the clinical trial. Why? Because the clinical trial is a very confined condition. It was very specific, and you expect that it'll be the same in the real world, but you can't do a clinical trial in the real world. You're either giving the vaccine to everyone or you're not. So you look at the clinical trial, you look at it and you say, all right, let's give it to everybody. But what happens next, you can't predict necessarily. That's normal. That's the way vaccines are. It's like unlike any other kind of medicine. You take a weight loss drug and you say, okay, in the trial, on average, people lost 12%. You can expect on average to lose 12%. You may lose 6, you may lose 18, you may lose 3, you may lose 25, but on average person will actually get 12% weight loss. Problem with the vaccine is 80% of people could have had less symptoms in the vaccine, but when you give it to everybody, nobody gets less symptoms. Never know. I don't know if we're ever going to get anti-aging technology. It's kind of a LARP, if you ask me. Novo obesity pill submission to FDA? Not sure. What you talking about, dog? I mean, they've had oral semaglutide for a while. Okay, so it was, I guess, a higher dose version? I don't think that's that big of a deal. Yeah, I mean, they have oral semaglutide, so it's really just, it is FDA approved. It's just a higher dose version, which is like really not that much of a. You got a new token to short? I love shorting tokens. I don't want to call it a bloodbath, but I do think we've had a long period of up only. Really, if you stretch back all the way to 2008, but 2001 had some pretty big downturns, right? We had like a venture-fueled boom. 2021 going into 2022 was pretty big. Yeah, I think Novo believes that nobody can really make a generic semaglutide. It's not the way I would look at it. Yeah, Seth, Amgen's certainly trying. Just talking to some old hedge fund friends, trying to get them all to join Godel so that we have the very best, high-quality people in there. Who are super sharp. Yeah, I got to start working out. I agree. It's a rough life. I never have time, but of course I do. I just don't want to do it. But I think once I have the baby, once she has the baby, I'm not having it. Once we have the baby, I'm going to be sitting there cheering. That's about all I'm doing. Then I'll probably have a little bit of weight. I mean, I think that this rapid loss in the last 2 months in the market has definitely shook a lot of managers. There's a lot of funds that are down 20% already this year, which is for a lot of hedge funds, that's enough to actually close up, right? So yeah, for a lot of guys, Pluto, yeah. But some of these guys I'm talking about are like biopharma guys and stuff like that. The biotech guys they're a lot more volatile anyway. But there's one fund, I won't say who, but in the last 5 years, they had 1 year where they were down 50, right? They had 1 year where they were down 30, and now they're down 30 again. And they had 1 year in there where they were up 40, to be fair. But they had the only other year there was they were flat 1 year. So I like this. No sequel is a mistake. Let's go. Yeah, you would think that's a wrap. As K, I like that. I had a friend who was a trader. One of my best friends growing up on Wall Street was a trader. It was this black guy. And just saying that already, you might know who he is. He worked for a smallish firm, but he was very, very good. And now he does something else. But we're growing up trading. And, me, I like to short stuff and, long as well and all that stuff. But, every now and then we'd short something together and we'd research it together and, we'd come up with some good stuff. And then he'd always say, if something failed, he'd be like, that's a wrap. It's a wrap. It was his favorite thing to say over and over again. He's like, nah, it's a wrap. He was a very, very extremely credentialed guy. But, every now and then the Urbans would come out. It was hilarious. That just reminded me when you said it's a wrap. That reminded me of him. I'm so happy because that was such a good memory. Yeah, we had a lot of fun. Talking to him was the best part of my day.